Thanks everyone for joining. Welcome to our Data for Impact webinar on lessons learned for drawing on multiple secondary data sources in evaluation. I am Jessica Farringer, the Technical Director of Data for Impact. So for those that are unfamiliar with Data for Impact or D4I, we are an Associate Award of Measure Evaluation, and we continue Measure's legacy of building evidence to improve health systems and programs. Data for Impact supports countries to generate and use high quality data to improve their programs, policies, and ultimately, of course, health outcomes. We also strengthen the technical and organizational capacity of local partners to collect, analyze, and use data. This is our third webinar in a series sharing lessons learned and practical suggestions on using routine and other existing data for evaluation and research. The fourth in the series will be in late March on using routine information to conduct facility level efficiency analysis. We will announce that date shortly on our website and email listserv. So we created this webinar series with the goal of providing practical information that helps global health evaluators and researchers to make better use of routine and other secondary data. Evaluators have often avoided use of such data, preferring to use other data sources that were designed to meet specific evaluation objectives, things like standalone surveys. However, it is important to consider routine and other existing data in light of the potential time and cost savings compared to collecting primary data. They do, however, come with their own set of challenges to consider and address. Today, we are focusing on using multiple secondary data sources in evaluation, and we'll discuss related work in Nigeria. So let me introduce you to our presenter, Emily Weaver. Dr. Weaver has worked for 16 years in research and evaluation of public health programs with expertise in reproductive, maternal, newborn, and child health. And at Data for Impact, Dr. Weaver leads evaluations in sub-Saharan Africa and Asia for programs focused on RMNCH, nutrition, and HIV. So Dr. Weaver, why don't you go ahead and take us through your presentation? Thank you.
Thanks, Jessica. So again, just briefly, I want to say that we provide this webinar because the increasing availability of data from multiple sources in low and middle income countries has stimulated an increased interest in using existing data to bring new insights to population health and nutrition problems. And there are many different types of secondary data sources. For example, routine health information system data, population-based surveys, census data, and civil registration and vital statistics system data. In this webinar, we'll be focusing on population-based survey data. However, some lessons apply across different sources. Using secondary data has several benefits and challenges, as Jessica mentioned. The main benefits include that it is perceived as a cost-effective source of data because it has already been collected by usually someone else, and that it is also at times more immediately available than data that would need to be collected from scratch. At the same time, there can also be many challenges with using secondary sources of data. When you don't have control over the data collection and design of data collection tools, you lose control over the data quality, format, and structure of the data. There may also be requirements related to accessing the data, such as obtaining permissions from the owner of the data, and that can take time to negotiate. Another important thing that is not always top of mind is that available guidance documents may be available with varying detail and sometimes not available at all, for example, about sampling plans or indicator definitions. And finally, related to the format and structure of data, availability of required data elements or indicators can also be problematic. It is this last point that motivated our aim to link data sources from secondary, data from secondary sources to conduct this study. So for the rest of this webinar, I'll walk through the study we conducted using two sources of secondary data. highlight the motivation for this and the lessons we learned during the process. The USAID Bureau for Resilience and Food Security, or RFS, identified a pattern of nutritional outcomes in some countries where we work, where stunting was decreasing but wasting was not. This graph is an example of that pattern in India, where stunting has decreased from over 50% in 1998 to 38% in 2016, while wasting has remained largely static. RFS was interested in learning more about factors related to this type of trend. We had the opportunity to explore this issue with support from RFS at USAID. As I get started, I want to thank and acknowledge my colleagues from D4I and Measure Evaluation who collaborated on this effort, Sean Curtis, John Spencer, and Gustavo Angeles, and also our counterparts Lindsay Anna and Ann Swindale at RFS. So traditional research about stunting and wasting has mainly focused on the use of household surveys, which more frequently measure anthropometric outcomes, such as stunting and wasting, even though we know that there are many other factors that influence these outcomes. This is a conceptual framework from Black and colleagues in 2013 that shows the many factors that influence stunting and wasting. These outcomes, stunting and wasting, would be found in the kind of middle orangish box, which says optimum fetal and child nutrition and development. In this framework, factors that affect stunting and wasting are not only demographic and household factors, but also include what they call nutrition-specific intervention and programs, which is here in the purplish blue box on the left and center. These are things such as breastfeeding, complementary feeding, and treatment of severe acute malnutrition, and also includes nutrition-sensitive programs and approaches shown in green on the right and center. These are factors such as food security, women's empowerment, and water and sanitation. You'll notice that many of these diverse influences, such as community level factors, are not available in typical household surveys. Thus, maximizing additional learning on these outcomes guided by this framework required a different approach and the use of different data sets, primarily to pull in pieces for the nutrition sensitive indicators. We started with a broad set of objectives that we refined over time. They were to conduct a cross-sectional analysis of stunting and wasting while incorporating nutrition sensitive and nutrition specific indicators by linking in additional data, to establish a proof of concept for the analysis approach, and lastly, to provide learning about the feasibility of replicating the analysis for other countries, including techniques for linking to secondary data sets. Now, if you notice, I put the information about Nigeria here in brackets because we went through an extensive exploratory process to identify a country where this analysis would be possible. And I'll go through some of those details in the next few slides. The process involved several steps. We first identified a data set for linking with the DHS survey. We selected a country for analysis. We developed linking method. We selected and developed indicators and finally merged the data sets. And this was a really time-intensive process. In your own research, you may start out with a specific country or more narrow question that wouldn't require such an exploratory phase. But in this specific study, we had a broad objectives to start. So to conduct the analysis, we first had to identify feasible sources of data that could provide information on stunting and wasting, and also additional determinants identified in the conceptual framework. We quickly identified the demographic and health survey as a good source of our outcome data, stunting and wasting, and set about finding other sources of data that could provide information on nutrition sensitive and nutrition specific factors. After an extensive inventory of additional secondary data sets, we identified the World Bank's Living Standards Measurement Survey with integrated survey on agriculture as a potential source of those additional factors such as availability of food, community infrastructure, and other development programs. Some of the other data sets we explored are listed in our study report that we'll link later when we send out the link to this presentation. So after we identified feasible sources of data for the analysis, we needed to identify a country with a desired pattern of stunting and wasting with data from these sources that could be used. So principally that meant finding countries with a desired pattern of decreasing stunting and increasing or stagnant wasting, ideally with a recent DHS survey, and living standards measurement survey data during the same or similar time period. And this table provides an example of the availability of these survey data and the time periods for 2 example countries, and the graphs show trends in stunting and wasting for those same 2 countries. So you can see that the DHS typically is collected every 5 years or so. So those are at fairly large time intervals, and the living standards measurement surveys were collected at more frequent intervals. And here you also see that the overlap isn't necessarily identical in terms of the years that the data was collected. So based on this assessment and several other factors, Nigeria was selected for this study. I want to note that after we selected Nigeria for the analysis, and we were fairly far down the road, we learned of potential problems with a 2013 DHS survey anthropometric outcome data for Nigeria, specifically for stunting and wasting. And so that left us with data from the 2018 survey round of the DHS and data from the 2010 round of the Living Standards Measurement Survey. Next, we had to think about linking or merging the data sets together. First, to get an idea of how much overlap there was between the surveys, we overlaid the DHS sampled clusters with the Nigeria Living Standards Measurement Survey, which in Nigeria is called the General Household Survey, or the GHS. This map shows how the survey samples are spatially distributed. In blue, you can see where the DHS clusters are located, and in orange, you can see where the GHS clusters are located. So you can see that clusters are not necessarily in the same places, and that has implications for linking the data sets. We needed to think about how to link them together, and we wanted to link the data at the smallest common geographic unit possible. And in this case, that was the local government area, or LGA. The Demographic and Health Survey and General Household Survey did not use the same unique identifiers for LGAs, so a GIS approach was used to facilitate linking the data sets. To leverage the data to the fullest extent, we applied 2 methods for linking data. The first, depicted on the left, was a direct or matched linking method, where we linked data from the DHS with GHS by local government area for those that had sampled clusters in the same local government area. And when we did this, only about 40% of DHS clusters were in a local government area that also had a GHS cluster. So relying on an exact LGA match to link the data greatly reduced the available sample and therefore available power for the analysis. So we next applied a second method for matching as well, which is depicted on the right, and that we call nearest neighbor linking. How this worked is that we linked a DHS cluster with GHS estimates from its nearest neighbor LGA shown here. You can see that the same LGA as the DHS cluster does not have a GHS cluster, as in the example on the left, but the adjacent LGA has a GHS cluster that is used as a proxy for the direct match. The nearest neighbor matching has the benefits of increasing the sample size for analysis and reduces potential selection bias associated with restricting the sample to DHS clusters that are located in an LGA that also has a GHS cluster. However, it assumes that the LGA level variables from adjacent LGAs are good proxies for the LGA in which the DHS cluster is located. So this introduces an additional level of potential measurement error. In this particular analysis, we also encountered additional challenges with indicators from both of our sources. For example, our outcome of stunting and wasting are relevant mainly for children between 6 months and 5 years of age. However, specific questions on important determinants of these outcomes were only asked of specific subpopulations. For example, breastfeeding and history of breastfeeding is important for nutritional outcomes. However, certain breastfeeding questions are only asked of children under a certain age in the DHS. Because of this, we had to compromise and we ended up using a derived indicator to indicate whether the child was still breastfeeding, weaned, or never breastfed. Another example is that we sought to create a measure of food availability based on the 7 food groups used in the indicator for minimum acceptable diet. However, we found that 4 of the 7 food groups were almost ubiquitous in the surveyed communities. Thus, we had to think about a different way to capture availability of food. In the end, we used availability of the 3 other food groups directly in the models that provided some variability of availability in the surveyed communities. These food groups were dairy, eggs, and vitamin A-rich foods. Second, we had to consider how to employ variables from the conceptual framework in a meaningful way when aggregated up to the LGA level. As an example of this is the price of food. If you think back to the map and the small size of the clusters within each LGA, you can imagine that there is the potential for significant variation in prices of food within an LGA. Consider urban centers versus rural areas. If a survey cluster falls within an urban area and the prices of food in that area are used to represent food prices of the entire LGA, including rural areas, this would create a problem with measurement error. So as you can see, we had to make some trade-offs with the variables we selected from each survey for this analysis. Individual and household level variables were drawn from the DHS, and most community level nutrition sensitive variables were drawn from the GHS and aggregated to the LGA level. But linking with the Nigeria GHS did provide some additional information about determinants in the conceptual model. The indicators here in red are those that were derived from that additional source of data. Once the dataset was merged and ready for analysis, we conducted several analyses using a linear probability model. I will run through 3 sets of results briefly to illustrate several areas of learning that came out of the process. First, we conducted a DHS-only analysis to compare our results with conventional knowledge about these outcomes. Next, we analyzed the linked data with a direct linked GHS matched sample. If you think back, this is the sample where only LGAs with clusters from each survey are used in the data set. And then finally, we ran regressions with a nearest neighbor linked sample. So first we wanted to know how our results compare with existing studies and how stunting and wasting compared to each other as a kind of baseline analysis. Because existing studies have examined the relationship between wasting and stunting, mainly using surveys including demographic and health indicators, we first ran a model of wasting and stunting on variables from the DHS for the sample of DHS clusters that were in the same LGA as a GHS cluster. So this doesn't include data from the GHS, but it only includes data from LGAs that also have GHS data. So to orient you a little bit on this slide, we show in the table only variables that were statistically significant in the analyses. A plus or minus indicates the directionality of the association, and 1 or 2 asterisks indicates the strength of the significance. Excuse me. Other variables used in the analysis are shown at the bottom of the slide. So we found that male sex, household infection in the last 2 weeks, region, mother's education level, BMI of the mother, household wealth, and household age dependency ratio were significantly associated with stunting. We also found geographic region, mother's education, BMI of mother, and mother's occupation in agriculture to be significantly associated with wasting. These results are generally consistent with existing literature on correlates of wasting and stunting. And when we compared the correlates of wasting and stunting to each other, we found geographic region, BMI of mother, and mother's education level to be common correlates. Next, we wanted to know what we find when we add nutrition sensitive indicators at the LGA level. These are mainly the indicators that come from our additional source of data. So now we can look at what we see when we add in the LGA effects, such as including indicators for food availability, economic access to food, classroom education, women's empowerment, social safety nets, and health services with a direct match. So we are only using GHS clusters in an LGA with also a DHS cluster. And the additional variables of significance are LGA characteristics in the bottom half of the panel. So you can see there is not a lot of significance identified using this approach. In fact, no LGA characteristics used were significantly related to stunting, while only eggs being available at a market in the LGA, which is a proxy for food availability, was related to wasting. And this one significant variable is a bit troubling because we would theoretically expect that the availability of eggs in the market would have the potential to improve nutritional outcomes, but the association shows that they move in the same direction. That is, having eggs at the market versus not having eggs at the market is associated with the presence of wasting. So in sum, the LGA variables show few significant effects, and the one identified is not intuitive or in the expected direction. Third, we wanted to see what happened if we loosened our linking criteria using the nearest neighbor linking approach that I spoke about earlier. As a reminder, this approach increases the sample size, but also increases the potential for measurement error. So these results compare the matched versus the nearest neighbor results for stunting. You can see the large sample size we gained by using the nearest neighbor linking is over 14,000 compared with 7,800 in the direct matched linking method. Comparing results from these two approaches, the nearest neighbor linking method identified a little bit more significance, mainly in the demographic and household level characteristics, which is most likely due to the increased power. For several variables, the effect size and statistical significance changed relative to the models for the smaller matched sample. The effects of measurement error are hard to predict, and in these cases, multiple factors such as selection, measurement error, and sample size could be interacting to produce these different results. For the LGA characteristics in the bottom panel, with the larger sample size and the nearest neighbor linking, we found having dairy sold at the market to be significantly associated with stunting, which, like eggs in the previous matched model for wasting, is not the direction we would expect dairy to take. This slide compares the matched and nearest neighbor linking methods for wasting. These two models are mostly consistent regarding demographic and household level characteristics from the DHS. However, like the stunting models, both effect size and statistical significance changed relative to the models for the smaller matched sample for several variables in the nearest neighbor linking model. Example of these types of changes are dairy available at the market in the LGA and existence of a primary school in the LGA. So a few key takeaways. Linking these data sets allowed us to explore a wider range of potential drivers than is typically available in a single data source such as a DHS. In particular, agriculture-related variables are relevant to nutrition outcomes, but are typically collected in focused agricultural surveys. The results of the multivariate analysis were broadly consistent with previous analyses of DHS data on stunting and wasting. The LGA level nutrition sensitive variables added from the GHS were generally not statistically significant, and when they were, the results did not necessarily align with expectations from the theoretical framework. The significance of individual GHS variables also varied according to the model specification, whether using matched or nearest neighbor approaches. Overall, the additional nutrition sensitive indicators from the GHS did not add any meaningful insights on the drivers of stunting and wasting in this analysis. The disappointing results from these analyses reflect, at least in part, the significant data challenges that we encountered when linking data from two surveys. Since this was an exploratory proof of concept analysis, we made several pragmatic decisions in defining variables and linking the data sets to allow the analysis to move forward within a defined timeframe and resource envelope. These decisions allowed us to generate learning about the process, but significantly limited the scientific strength of the substantive analysis. In terms of lessons learned, The GHS data were collected 2 years after the DHS, so we had to treat the nutrition-sensitive variables from the 2010 GHS as proxies for the variables in 2008 when the DHS was collected. This is a strong assumption given annual variation in agricultural and other conditions, which effectively introduces measurement error into variables from the GHS data and undermines the substantive findings from this analysis. The differential timing of data collection from different data sources is a significant challenge in using data from multiple surveys. In selecting countries for the study, we found that it was difficult to identify countries that had existing data sets for the same time periods that could be linked to both nutrition-sensitive and nutrition-specific variables for the analysis. The challenges faced in this analysis show that linking data from independently sampled surveys is also problematic. The DHS and the GHS survey are independently sampled national surveys, so the data collected in each survey refers to different households. To address this issue, we needed to have a common unit at which to link the data, and we linked the surveys spatially at the LGA level by aggregating data from the GHS survey to the LGA level, and linking the aggregated LGA level variables to the individual data from the DHS. The LGA was the lowest geographic level of aggregation feasible, but an LGA is still a sizable geographic area. Further, neither the DHS nor the GHS survey were designed to produce statistically reliable estimates at the LGA level. As we saw on the map, sometimes a single GHS cluster represented the entire LGA. And this means that there was considerable sampling error associated with the aggregated GHS variables. If LGA measures of nutrition-sensitive indicators from the GHS data do not well represent the local conditions faced by the DHS households, then the conclusions drawn will not be internally valid. Even when using the LGA level for aggregation, only about 40% of LGAs had both a DHS and GHS cluster. So for those DHS clusters that were not located in LGA without a GHS cluster, we had to aggregate GHS data from adjacent clusters to link to the DHS cluster. This further exacerbated the internal validity issues that arise from assuming that the aggregated GHS variables represent the conditions faced by DHS households. Finally, all statistical analyses require choices in how variables and models are defined. The conceptual framework we use to guide this analysis includes a wide range of different factors that are hypothesized to influence nutritional outcomes. The DHS and the GHS survey contain many questions relevant to different elements in the conceptual framework, but they did not always readily translate into variables that were usable for the analysis. For example, some questions apply only to certain subgroups in the samples, so they cannot be readily included in an analysis that includes the full sample. In the DHS, current breastfeeding status is only asked for children under 2 years old, and dietary diversity is only typically asked for children ages 6 to 23 months old. We had to make some compromises to create derived variables for this analysis as a result. Some variables we wanted to include in the analysis based on the conceptual framework have only been included in later waves of the DHS surveys, such as micronutrient supplementation for children or supplementary feeding with a ready-to-use supplementary food. So these could not be included in this analysis. There were also multiple questions in the GHS survey on nutrition-sensitive factors such as crop diversity, household receipt of remittances, financial inclusion, and livelihood diversification, among others. But it was challenging to aggregate them in a meaningful way for this analysis. Significant investment of time would be required to test different specifications of aggregated variables to determine which specification, if any, would be most meaningful and viable for analysis. And given our time constraints, we did not include variables that were complex to aggregate in these models. I want to highlight several recommendations stemming from this work. First, we do not recommend linking data from 2 or more independent sample surveys at low levels of geographic disaggregation, such as LGA. Linking appears more likely to work well when linking a sample survey such as DHS to a data set that has complete geographic coverage, such as remote sensed climate data or potentially census data. Such an approach would, however, likely limit the range of additional variables that could be included to better understand drivers of the outcomes being examined. It could also be worth further exploring linking sample survey data to modeled surfaces obtained from other data sources, but we recommend focusing on using one modeled surface initially to test this idea. Using modeled surfaces would not eliminate measurement error concerns for variables at low levels of geographic disaggregation, and will work better for some variables than others depending on the precision of the models. It is time intensive to create modeled surfaces, so using existing publicly available models will be more efficient. However, the existing models we were aware of tend to focus on outcome variables such as stunting, rather than nutritional specific independent variables, which were the focus of this analysis. Next, for some research questions linking data at higher levels of geographic disaggregation, such as geographic region, could be sufficient for meaningful analysis. For example, individual data from a DHS survey could be linked to aggregated variables at the region level from an agricultural survey that provides adequate statistical precision for regional level estimates. Whether this is meaningful will depend on whether the regional level is granular enough to be relevant conceptually to the question of interest. And then finally, in all linked analysis, the different data need to refer to the same time period or to be otherwise meaningfully related temporally. In conclusion, the increased availability of data from multiple sources in low and middle income countries have stimulated an increased interest in using existing data in innovative ways. And this study has generated lessons learned on the process and challenges involved in bringing data together from different sectors to analyze the drivers of stunting and wasting. We identified several significant data challenges that undermine the credibility of the substantive findings and were unable to demonstrate that the proposed approach was feasible in this case study. Similar challenges are likely to be present in other contexts. However, some of the approaches we explored for this analysis could be useful in other applications. New data science methods are not a panacea for underlying data problems, such as sparse or poor quality data. Use of existing data requires compromises to accommodate the data available, which can undermine the credibility of the substantive results, as we saw here. More sophisticated methods can require substantial investments of time from highly specialized analysts, which will have significant cost implications. So I think you can see that using existing data will not necessarily be cheap and quick either. Although we have more and better data now than ever before, in addition to more and better ways of analyzing them, challenges remain to linking data for complex analyses in this context. So I'll stop there. Thank you very much for your attention, and we can take some questions for the remainder of our time. So there are some methodological questions here that I can answer quickly. Cross-sectional analysis methods just means that we use data from one point in time, as opposed to using data, for example, from two different waves of a DHS survey. In this case, it would have been 2008 and 2013. So we just use data from 2008. And then in terms of variable definitions, BMI of a mother is a measure of her height to weight ratio that's commonly used in nutrition studies. So there's a question here. This type of linking is very dependent on gaining access to the LGA level data, which is not readily available. How would linking work with more publicly available data? So I guess what I would say is that the data that we used both of the data sets are publicly available. You just have to request access to the DHS and the GHS through the website. So we didn't have trouble getting access to the data. What we did have a little bit of challenge with was accessing information about LGA level boundaries for the linking method. So for that, we had to identify a source of GIS data, which had the LGA boundaries. And that came from actually the Bill and Melinda Gates Foundation. And more information about that can be found in our report. But in terms of the data being available, I think these two sources are good examples of publicly available data. Okay, here's another question. What do you mean by modeled surfaces? So that's a good question. A modeled surface is one where you have data, for example, from the DHS, and the DHS does create modeled surfaces on certain specific indicators. But you would have a sample survey, for example, the DHS, that collects estimates on particular indicators, but you want to extrapolate the estimates from those particular survey clusters to other areas that were not surveyed. So what you do is you take the estimates that you have and you develop a model to predict that outcome or that indicator. And then you use that model to predict the level or value of that indicator in other geographic areas. So it's basically an imputation model or method that uses the data that you have to predict the level of that outcome in other areas. And so what you can end up with is estimates for your outcome in areas that weren't sampled. So at a high level, that's what the modeled surfaces mean. So it just provides a greater geographic coverage of your outcomes in places where you haven't necessarily collected data everywhere. So this next question, triangulation of data sources is important. What parameters do you use in identification of the sources to triangulate? So as I mentioned, I think we went through a pretty extensive process of trying to identify additional data sources that would include the nutrition sensitive or nutrition specific indicators that could be available for linking. So in terms of triangulation, we needed to find other data sources that had the variables that we were looking for, first of all. And we also wanted them to be available in the same or similar time period as our outcome data source, which was the DHS. And then accessibility to those data was also important. So there are a number of other different data sources that provided information on certain variables in the conceptual framework. Many, I would say, of those data sources would provide information on just one or two variables in the conceptual framework. So including those data sources would have meant a lot more merging and linking of the different data sources. So we ended up using the GHS because it had a breadth of additional indicators to include in our analysis. But those are the main things that I would say are important when you're considering which other sources to triangulate. This is the next question. Do you think linking survey data with routine data could be helpful? For example, the NHMIS in Nigeria collects few routine data on nutrition among pregnant women and children and might have been used to triangulate with the DHS. Do you have some experiences with this that you could share? So off the top of my head, I don't think of any analysis that I've done specifically. There may be other work at Data for Impact that I'm not aware of that specifically linked routine data with a population-based survey. But I think this is a a type of data that we mentioned in our recommendations that would be a good source of linking, because a national HMIS system such as DHIS2 would have data from the whole country. So you wouldn't have the problems that we had in terms of having to link data from places that were not exactly the same. However, I would say that in terms of the DHS data specifically, a lot of times, or at least in the cases where they're collecting data on HIV outcomes, they offset the GIS data so that you can't identify exactly where the cluster is located for privacy concerns. So even though you could potentially link using GIS methods, the data from DHS clusters to a very similar area using the DHIS2, assuming that you had GIS information for the health facilities in your HMIS or your DHIS2, you would still have some measurement error in terms of the direct linking of those data. So I hope that kind of makes sense, but I think that's a good suggestion in terms of using HMIS data. I guess one other issue that comes to mind with that is that, and this is a little bit less major as the other issue that I mentioned, is that you would link the households based on their geographic location and proximity to facilities, I would assume. And in that case, you're also assuming that the people in those households go to the nearest health facility when we know that's not necessarily always the case. There's some bypassing of health facilities. Those people could go to private health facilities that aren't in your national HMIS. So there would be some other considerations there as well. There are several questions about availability of the slides and the presentation later, and we will be providing a link to the recording of the presentation and the slides at a later date. One question here is about using small area estimation in the analysis. Did you consider incorporating techniques from small area estimation into this analysis, both the individual MV analysis and linked analysis? No, we did not talk about that approach here. This question, I think I addressed briefly, but I'll talk about it again. How effective is it to use data sets from different sources that had data collected in different time periods? So I think one of our key recommendations is not to do that. In this specific study, we sought to identify sources of data that were available generally within the same time periods. And initially, we even had intended to conduct a longitudinal analysis, so taking data for 2 different time periods from the DHS and the General Household Survey. So that's why we selected Nigeria. The 2013 survey of Nigeria lined up pretty well with the GHS survey in Nigeria. And the 2018 Nigeria DHS wasn't available at the time that we were designing the study. So when we found out that we couldn't use the 2013 Nigeria DHS stunting and wasting estimates, or that there may be problems with those estimates, we decided to do just the cross-sectional analysis on the earlier wave of the DHS data. And that's what landed us with data sets from 2 more disparate time periods than was ideal, from 2008 and 2010. So I think that's a key piece of learning here that may not be a good idea. Because this was a proof of concept analysis, and the results of the analysis were only part of our objectives, that made sense for us at the time. So another question, any recommendations for data survey programs in designing their surveys to make the sampling more comparable for this sort of analysis, if countries are amenable to it? So I think this is a tough, it's a good question, but I think pragmatically, it can be kind of difficult. These population-based surveys are really meant, in a lot of cases, to produce national level estimates for population indicators. And because of that, they have large samples, and they're also extremely expensive to implement. So I think one of the possibilities for making these surveys more comparable for the sort of analysis would be to design the surveys in a way that the estimates are representative at a lower level of aggregation. So for example, for the DHS in some countries, they design them so that they're representative at the regional level. And for a certain subset of indicators, they may be representative at a district or lower geographical level of aggregation. And I think those types of decisions would make it easier and more feasible to use these sources of data in this way, but it would also increase the cost of the data collection. If you are doing something a little bit smaller, like you're running a program in a country and you're designing your own data collection, and you want to link it with another program's data collection. So example, if you're doing a household survey and another program is doing a health facility survey and you want to link those data, it would be helpful for you to be able to coordinate ahead of time to perhaps sample in the same areas or use the same clusters for data collection. Those would be my suggestions. The next question I'll answer, have you published this yet? I would be interested in details about your application of the nearest neighbor method. For example, is a neighboring GHS cluster potentially matched to more than one DHS cluster or vice versa? Is there an upper tolerance beyond which no neighboring cluster is near enough to use? So we do have a report on the website that we'll link when we send out the information with the recording and the slides for this webinar, or you can search on the Measure Evaluation website. And we did struggle a lot with how to do the nearest neighbor linking because we knew we wanted to increase our sample size. And at the same time, we were concerned about the measurement error involved in doing that. So we thought about only linking GHS clusters, for example, that were on the border of the DHS LGA, or whether we wanted to go more than one LGA away from our target or DHS LGA. And I don't know that there's any particular standard for doing that. But we, as I said in the presentation, we linked to only LGAs that were bordering our DHS LGA. And in some cases, there would be an LGA next to a DHS LGA where the DHS had more than one cluster surveyed, or more than one LGA bordering the DHS LGA had GHS clusters. And in that case, we aggregated the estimates within each LGA and then averaged them across the LGAs surrounding the DHS LGA. So that ended up giving us an average of the surrounding LGAs for the GHS estimates. And that also creates some concerns for measurement error. So there are trade-offs that you have to make, and we don't give specific guidelines about that in the report, but you can read more about it there. Thanks for your question. So the next question I'll answer, DHS GPS location data is displaced by 5 to 10 kilometers. Do you think that could have affected the result? Yes, I think that's a possibility, but it's something that we didn't have any control over. So we were trying to approach this with the most kind of pragmatic way that was feasible with the information that we had. So ideally, no, the GPS location would not have been displaced. So there's some notes in the questions. I will share these links that there are some DHS publications that could be helpful for some of the questions that are asked, and I'll go ahead and share those. One on using HMIS and DHS data to triangulate, and another one without a specific topic. Okay, so I think I've answered most of the questions in the Q&A. If there aren't any more questions, then I'll hand it over to Jessica to close us out.
Great, thank you, Emily. Thanks everyone for joining us today for the webinar. As I mentioned at the beginning, we have our 4th webinar in this series coming up in late March, and we'll be announcing that shortly on our website and also on our Data for Impact listserv, so you can be on the lookout for that. And this webinar, the recording from this webinar, will be posted on our website, and all registrants for the webinar will receive a link to that recording as well, along with the slides. So thanks so much. We hope to see you in the future at one of our other webinars, and have a good rest of your day.